Spicy, and I am here tonight or today, whenever you see this, to talk a little bit about epilepsy and the potential for seizures to be triggered by severe allergic reactions. And the reason that I am talking about this specifically is because one of my providers, my mast cell specialist, suspects that I might have absent seizure episodes happening on occasion, and I do have videos or clips from videos that I can put together to show episodes of slurring. And I can share a few stories from instances that have occurred in the past that definitely were either in what I think are referred to as ischemic strokes, mini strokes, or absent seizures. And so I'll be evaluated for that soon, I hope. I know there's going to be like MRIs involved and all that stuff, which is going to be crazy because when my last telehealth appointment with my medical provider, she asked me directly if I had accidentally taken too many of any of my controlled medications, or if I was drinking because I was slurring. The problem was that I didn't recognize that I was slurring, so I didn't hear it. When I do record videos or live stream and I know I am a lot of the times I'm aware of it. I can hear it. But at this point in time, it was the middle of the afternoon. I had been out of my mast cell stabilizing medication that also is an anti-anxiety medication, and it's in the Benz family. The entire class has mast cell stabilizing properties. And I had been out of it for about 24 hours and was waiting for my husband to come home from work with my refill, with my next bottle for the prescription. I did not yet have intramuscular Benadryl in my medical protocol, so I was not like MCAS stable. My histamines were probably all over the place. And just H1s and H2s alone do not control my mast cell. I need to have I need to have the other two for both stability and rescue. And that could play a part in what has been happening. So let's see if we can share here so I can show you what I'm looking at. Let me see here. We are going to look at, all right, that one. All right, so this is from Medical News Today, and this is an article entitled "What to Know About Seasonal Allergies and Epilepsy." In some cases, seasonal allergies can increase a person's risk of having a seizure. Some research suggests a connection between allergic diseases and epilepsy, and I would consider mast cell activation syndrome to be part of that category. Certain research suggests that children who experience allergic rhinitis are more likely to develop epilepsy. However, this research is not specific to seasonal allergies. Okay, so let's look on. Doctors do not fully understand the connection between allergies and seizures. However, research has suggested that increased inflammation in the body due to allergic reactions may make someone more prone to seizures. It is also possible that an underlying condition causing inflammation could cause both allergies and seizures. Hi, MCAS. However, at present, there is not sufficient evidence to prove these theories. Some of the ways that seasonal allergies affect the body may trigger seizures in individuals with epilepsy. For example, allergies may make a person lose sleep or feel stressed. Both of these are potential seizure triggers. In general, seizures are more likely to occur in those with epilepsy when they are ill or physically and or mentally run down. People who experience seasonal allergies also have an increase of anaphylaxis. This is a severe allergic reaction that can sometimes cause seizures, although it is not a common symptom. And unfortunately, most of my medical issues do not fall within the category of common. Therefore, a person who has seasonal allergies may experience anaphylaxis due to a different allergic reaction. However, it is very rare for an allergic reaction to pollen to be severe enough to cause anaphylaxis. Anaphylaxis is a severe life-threatening reaction Anaphylaxis is a severe allergic reaction that can be life-threatening. Symptoms include and develop suddenly. Symptoms include hives, swelling of the face or mouth, wheezing, fast, shallow breathing, a fast heart rate, clammy skin, anxiety or confusion, dizziness, vomiting, blue or white lips, fainting or loss of consciousness. Actually, I'm going to, I'm personally going to say that from my experience and what I've read, if you get to the point of fainting and loss of consciousness because of blood pressure drops and anything, that's when you're at anaphylactic shock. And that's one of the reasons that I think there's a lot of confusion between the two. People confuse anaphylaxis for anaphylactic shock because the medical dramas have all trained us to think that that's what anaphylaxis is. But anaphylactic shock is that's the point you need to be like in the ER, in the back of an ambulance, or already in the ER, and the EpiPen is what is meant to keep you alive till they get you there to stabilize you, hopefully. If someone has these symptoms, check whether they're carrying an EpiPen. If they are, follow the instructions on the side of the pen to use it. Hopefully they have more than one. I have a friend who is a registered nurse who says she always carries 4 because sometimes the pens misfire. So you need to make sure that you carry at least 2. Dial 911 or the number of the nearest emergency department. Lay the person down from a standing position. If they vomited, turn them on their side. Stay with them till emergency services arrive. And some people may need more than 1 EpiPen. If the symptoms do not improve in 5 to 15 minutes or they come back, use a second pen if the person has one. Allergy, seizure symptoms. This is what we're talking about. I'm trying to do a little bit of research on whether or not I can find things and research that I can take to the doctors when I am evaluated for potential seizure and or mini stroke activity. And the thing is, I pointed out to my medical provider that I do not have just the symptoms when they don't just come out of nowhere. It's always connected to a trigger, a major histamine dump, or an allergic reaction to something. And it's consistent going back throughout the entire history of every episode that I can remember. It's always connected to a histamine related issue. And that's why this is what we are talking about today. All right, let's go back to the story that I was looking for. Oh, I just lost the page. Here we go. All right, allergy seizure symptoms. There are several different types of seizures that people living with epilepsy may experience. Epilepsy seizures fall into 2 main categories: focal onset seizures and generalized seizures. Their symptoms are as follows. Focal onset seizures. Focal onset seizures affect one area of the brain, and people sometimes call them partial seizures. Within this category, there are focal aware seizures and focal impaired seizures. Possible symptoms include sudden unexplained emotions, a sense of deja vu, seeing, hearing, smelling, tasting, or feeling things that are not really there. Okay, yeah, I can. Weakness, numbness, tingling, an inability to move or speak, a change in awareness levels, a blank expression, being unresponsive or responding in an unusual way. Okay, I'm going to say that I believe that the last episode that I had uh, fits more than one of these symptoms. I had sudden and unexplained emotions. I had issues where I literally lifted my cheek for my husband to kiss it because I thought that he was there getting ready to go to sleep. And then realized he wasn't. And yeah. A change in awareness levels, I would say that qualifies. Yeah, okay, so I had at least 3 of those symptoms in the last episode. But I also have slurring happening too sometimes too. Generalized seizures often affect both sides of the brain. Several types of seizures fall under this category, and symptoms may vary. And they may include a blank expression, being unresponsive, slight muscle twitching. I have that. Muscle weakness, muscle stiffening, repeated muscle jerking. Falling down or dropping the head. I do that too. I've had episodes where my husband, my daughter, people I've been with, have thought that I was nodding off while they were talking to me. And the last episode with that one happened when I had a hairdresser using actual rubber bands in my hair to section it for braiding when I had told her that I was allergic to latex. All right, common seizure triggers. Common triggers are alcohol consumption, menstruation, which interestingly enough is the biggest trigger for my MCAS symptoms when I am extra hormonal right before my cycle starts and that happens to a lot of women who become severely allergic to things that they're normally not allergic to. And I have seen research from Dr. Afrin. I will try and find and include that in the description box regarding PMDD and mentioning PMDD, premenstrual dysphoric disorder, as an actual symptom of mast cell activation syndrome and not just its own thing. Certain birth control pills and missed medication. Let's see, risk factors. Seasonal allergies are more likely to trigger seizures. I can never say that word actually, so I'm not messed up right now. I just can't say that word. I always trip on, which is ironic. Anyway, seasonal allergies may be more likely to trigger seizures if they are severe. So I would say any allergy would be more likely to trigger the seizure if it is severe, as the body may be under more stress, leading to more common seizure triggers such as stress and lack of sleep. When to contact a doctor. Anyone who experiences a seizure for the first time should seek immediate medical attention. That's only going to happen if the person who's having it actually knows they're having one, as opposed to just thinking it's brain fog, because brain fog is a pretty general term, and that's what I thought. If a person with epilepsy thinks that seasonal allergies may trigger seizures, a doctor may be able to prescribe medication to control allergy symptoms. H1s and H2s, baby. and mast cell stabilizing medications. Additionally, if someone with epilepsy experiences any new symptoms, they should contact a doctor immediately. Summary. Individuals with epilepsy may find that seasonal allergies trigger seizures. This may be due to the stress from the symptom as well as a possible lack of sleep and generally being run down. Since so many people with mast cell activation syndrome are neurodivergent and people with neurodivergence, either ADHD, ADHD, or autistic, or anything else that falls under that category, often have dysregulated sleep cycles and dysregulated circadian rhythm. That's going to be high on the potential list. There's no specific type of seizure related to seasonal allergies, but symptoms could trigger any kind of seizure. There's also evidence that those with seasonal allergies may be more likely to develop epilepsy in childhood. Anyone who has epilepsy and is experiencing seasonal allergies may want to contact a doctor to help control allergy symptoms. So that's medical news today. Leaving that link up because I need to be able to find that later. Other illnesses, as this is from Epilepsy Foundation. Other, let me go to, go back over here, share the correct page. And we're going to share, all right, let's share this one. Let's see, lack of sleep and epilepsy menstruation as a seizure trigger, missed medications, nutritional deficiencies, other illnesses. All right. Okay. Does being sick with other illnesses trigger seizures? Let's see. This one's talking about things like seizure, like being sick, having a fever, getting dehydrated if you aren't eating or drinking well, stomach bugs, that kind of thing. Let's see, the most common OTC medicine that may affect seizures is probably diphenhydramine. Interesting. This medication is the active ingredient in medications like Benadryl, which is used for colds, allergies, and sleep. And in many cases, it's a medication that many people with MCAS have prescribed to them. And a lot of us are on intramuscular or IV. Other medicines for head colds, allergies, and other conditions have ingredients that may affect seizures or seizure medicines. Let's see. We're going to keep on looking here and see. We don't need to know about antibiotics. Let's see if we can find one specifically on MCAS and epilepsy. Let's see. Let's see, we are going to screen share that one, and then we're going to move on to the next topic after I take a quick break and chat with my friends on TikTok. All right, share screen. I am searching for MCAS. One second. Where we go? Let me find the right page. Can MCAS trigger seizures? All right. Let's see. We're going to look at this one. This is Dr. Tanya Dempsey. MCAS, Lyme, and complex disease. Mast cell activation questions answered. All right. So, first question. That's probably the only one we're going to look at today. Is there any correlation between MCAS and seizures or seizures-like activity? If an EEG is done, should there be anything specific looked at in an MCAS patient? All right, this is good information for me and anyone else who may suspect the same thing is going on with them. I know of no studies identifying any findings on EEGs which are specific to patients with mast cell disease of any type. Also, though I don't know of any correlation between MCAS and seizure or seizure-like activity, both seizures and activities which are seizure-like but shown by EEG not to be true seizures, i.e. so-called pseudo-seizures, can be seen in association with MCAS and other mast cell disease too. It seems more likely than not, quote unquote, that the development of seizures or pseudo-seizures in a patient with proven mast cell disease is related to the mast cell disease, but it must be kept in mind that there are many potential causes of seizures and pseudo-seizures. Therefore, it is important for patients with proven mast cell disease who also develop seizures or pseudo-seizures to undergo appropriate evaluations for those neurological issues to make sure that other non-mast cell disease-related causes are ruled out to the extent possible before more seriously considering the possibility that it is the mast cell disease which is driving these neurological issues. Interesting. So let's look at one more because I found this one from one I will have to tag I think it's Dr. Joe on TikTok. Let's see here. All right, absence seizure signs. We're sharing that one. And we're going to watch a quick video. This is Dr. Joe MD on TikTok. Here we go. This is an example. Okay. All right, so there you go. I will make sure I link. I will also include the links to Dr. Joe's profile and to that video specifically when I break this video up into individual ones. So that's what I've got for today on MCAS, allergies, and the potential for seizure activity. Please like, share, subscribe, and I will see you in the next video. Okay, so let me see. I'm going to scroll up and see what people are saying. Oops, 1 second. All right, so, okay, so I answered the PICC line question. Hey, Tomash, how you doing? Yeah, I was doing a little bit of research tonight on MCAS and allergies and the potential connection for seizures because, well, I might be having them, or I might have been having them for a long time and just not known it. Hello, I am pretty ill. Robin, yeah, I've had multiple people messaging me telling me that I've been live all day, which is really weird because my phone I didn't even have TikTok on all day. I recorded a few videos. I did a couple of edits, but I don't know why that happened. Is there anything about MCAS POTS and autoimmune issues like MS? I can look that up before I go on to the next official video. Let's see. MCAS POTS MS. Muscular. What is MS? Is that muscular sclerosis? Is that what we're talking about? What is okay? I need to look up FND. I know Ray's explained it a few times. Functional neurological disorder. That's conversion disorder. Okay, so let's see more. What is functional neurological disorder? Functional neurological disorder, also known as conversion disorder and functional neurologic symptoms. Disorder refers to a group of common neurological symptoms and movement disorders caused by an abnormality in how the brain functions. All right. All right, you know what? I'm going to start a second video. officially here. So give me a second. Hi, it's Pauline from Chronically Spicy, and today we're going to be talking about functional neurological disorder because I am trying to do my normal rabbit hole research before I am evaluated for potential seizure and or stroke, mini stroke activity, because I have had multiple issues and instances with things like slurring, muscle jerking, um, change in awareness, and multiple other seizure symptoms that I checked on a list on the epilepsy page. And one of my friends suggested that I talk about functional neurologic disorder. There you go. All right. FND. What is functional neurologic disorder? Also known as conversion disorder and functional neurologic symptom disorders, refers to a group of common neurological movement disorders caused by an abnormality in how the brain functions. FND is caused by another disorder, not caused by another disorder, and there is no significant structural damage in the brain. The exact cause of FND is unknown. FND was thought to be conversion disorder by Sigmund Freud because he believed a psychological disorder converted into a neurological one. Someone with FND can function normally, they just can't at that moment. Okay, that kind of fits. Their brain is unable to send and receive signals properly, and there is a disconnection at the function of the lobes and emotional processing. Memory, concentration, cognition, and the processing of sensations can also be affected. Oh, great. FND also causes real symptoms that significantly interfere with how you function and cope with daily life. If you have FND, your unplanned movements and symptoms occur without you consciously starting them and are inconsistent and distinct from symptoms that are intentionally produced. FND can involve any part of your body. Symptoms may appear suddenly, increase with attention to them, and decrease when you are distracted. That doesn't necessarily apply to me because if I'm in the middle of an episode, it's not stopping unless I'm medicated or like the histamine levels have leveled out. So but a lot of the rest of that actually did apply. I'm not saying that this isn't a possibility. I'm pretty sure it's probably going to be discussed when I am being evaluated. FND can be difficult for you, your family, and doctors to understand. Early diagnosis and treatment can help lessen symptoms and aid in healing. There's two primary categories: psychogenic, non-epileptic seizures, PNES, and functional movement disorder, FND. There are many types of FND with a diverse mix and range of neurologic symptoms and disorders. For some people, symptoms are short-lived while they may last years for others. I go through cycles, and I've learned, and this is interesting because keto was developed to stop epileptic seizures. And a lot of people eat keto, strict keto, 20 grams or less of carbs total for the entire day. And there's 6 grams of carbs and half a cup of broccoli. So that's where we're talking serious, strict keto, which I've done in the past. I have never had a problem when I am doing that. So psychogenic seizures may look like generalized other forms of epileptic seizures, but are caused by brain dysfunction and not by abnormal electrical signaling in the brain. You may have episodes of movement, sensation, and behavior similar to an epileptic seizure, and may have temporary loss of attention or memory lapse. I've actually had that. My husband actually asked me one morning or one afternoon when he came home from work why I had opened up the box of American cheese slices that we have from Sam's Club and tossed it all over the inside of the fridge. That was the same night that I had my hair done with the rubber band latex reaction. And I don't remember doing that. You might feel disassociated or somewhat disconnected from thoughts or feelings or from the environment. Oh, okay, that actually correlates because um I experienced what I call like Alice in Wonderland like type syndrome, which I know isn't in and of itself its own syndrome. Um, but like it's almost like if you're sitting right next to me, I when I'm having one of these episodes during a reaction, it's like my head's underwater under the surface of it, like in a swimming pool, and I'm just about to break the surface, and I can hear you talking to me, I can see you talking to me, but everything's like feels far away and here and sounds disjointed, and I feel like I'm in a bubble when everybody else is not. Um, yeah, exactly. Hybrid GCT. Okay, so let's see. Let's look at um, uh, PNES can be stress related emotional or psychological reactions to an ability to cope with a sudden or past event or events. I don't believe that is my issue. But FND, movement disorders, symptoms include or may include leg and arm weakness or paralysis. I haven't had that. Tremor. I haven't had that. Sudden, brief, involuntary twitching or jerking of a muscle or a group of muscles, myoclonus. I get that every month with my leg. Um, and interestingly enough, it's almost always triggered. It's always connected to my cycle and my daughter's cycle. So I react physically to my daughter's hormones, and she reacts to mine. Involuntary muscle contractions that cause slow, repetitive movements or abnormal postures, dystonia. I don't believe that fits me. Problems with walking, motion, gait, posture, or balance. I don't think I've had that. Spasms and contractures, in which the tendons become fixed in awkward or uncomfortable positions that doesn't fit. Muscle stiffness or tics. I don't think I have tics, but I know a lot of autistics do. If I have tics, I'm not. I mean, maybe I have stuff that qualifies as tics, and I just don't realize it. But I'm also like diagnosed autistic. I have. Let's see. So okay. So symptoms that affect other brain function may include speech difficulties, such as sudden onset of stuttering or trouble speaking. That happens to me 100%. That fits. When I used to get and this would always happen right before my cycle started, and because I was only taking my mast cell stabilizing anti-anxiety, panic attack bends when like I was waiting for the fire to start. I was literally only taking it as a control, like it was my rescue medication. And if I didn't take it fast enough, I was like literally zoning out for hours and thinking like 15 minutes had passed. Um, but I remember when my daughter, who is now 16, was younger, and um, I would get extremely anxious, um, super aware of my heartbeat, and then swelling, hives, whatever, and the speech difficulties. My brain and my mouth like could not connect, and I would stutter and try to repeat myself. And finally, I would tell her, "Mom, you can't talk right now. Let's just sit down for a minute and let this settle down." And she was super patient and never got scared or anything because I tried to stay as calm as I could and basically just zoned out with her while she did her thing. Problems with seeing or hearing, I don't think I have that. Pain, including chronic I do not have migraines. Extreme slowness and fatigue, don't have that. Numbness or inability to sense touch, don't have that. But that stuttering and speech difficulty thing with a sudden onset, that's definitely happened. Who is more likely to get functional neurological disorder? Anyone can develop FND. An estimate an estimated 4 to 12 people per 100,000 will develop FND. Fundamental causes may involve biological factors such as early childhood trauma, early life stress emotions, a propensity of anxiety. Hi, how are you? Witness to violence, maltreatment, or childhood abuse, or psychological factors, including interpersonal relationships and stress. Relationships and stress. Some of these factors can trigger episodes of FND. The disorders are more common in women, in particular in those with a history of early SA trauma. It can occur, but it is uncommon in children under age 10. There appears to be an association with depression and anxiety, early life trauma, or dysfunctional family life, or even the dislike of a job. FND sometimes has a psychological cause as one of the relevant factors and may result from a somatic symptom disorder characterized predominantly from multi-system symptoms that are associated with distress and or dysfunction and look like a physical illness. But what if it doesn't just look like a physical illness, because mast cell activation syndrome itself is a multi-system symptoms causing condition? Hmm? That could be a possibility. How is functional neurological disorder diagnosed and treated? No single test can confirm it. A doctor will assess your health and medical and family history, rule out neurological or other conditions that may cause symptoms that can coexist. A neurologist and a psychiatrist or a psychologist may look at specific patterns or symptoms to make a diagnosis. Tests include psychiatric exams as well as imaging to rule out other disorders. And there's going to be other tests such as electromyography, recording electrical activity in muscles, and electrosonography. I mispronounced that like crazy because I took my intramuscular Benadryl 20 minutes ago now, and I have hit the phase where my tongue is dry because Benadryl is I think the word is anticholinergic, and that's why I'm sipping on water. All right. So anyway, the video electro thing records what you're seeing or doing over a period of time from several hours to days while brain waves are being recorded until a seizure occurs. What can you do? Okay, well, this is good information. Prepare for your appointment by making a list of any symptoms you may be experiencing, a list of all of your medications, and a list of questions for your doctor. Be sure to include any family history of illnesses or trauma. Be prepared to answer questions about your past experiences, any mental health concerns you may have, and any recent social, emotional, or other life changes. Bring a notepad to take notes. Speak honestly with your doctor or primary healthcare specialist about your symptoms and consider an evaluation by a neurologist and a psychiatrist. Learning all you can about this disorder and knowing that your symptoms are real can help with your recovery and treatment options. All right, work with your care team for effective outcome, and lifestyle changes such as exercising, eating a balanced diet, participating in relaxing exercise, and getting enough sleep can help reduce stress and anxiety. Except we circle back to high ADHD and mast cell activation syndrome, histamine dumps, and the whole cycle starts again. Yeah. Okay. There are no specific treatments for FND, but there are treatments for some of its symptoms. That's actually, I actually love that sentence because that applies to mast cell too. There's that makes sense. Okay. A team of doctors and health professionals from various specialties work together to deliver a combination of treatments and comprehensive care. And knowing that your symptoms are real despite there not being an underlying medical disease can help you do better to cope with the disease, become motivated to make a change, etc. It's also possible to learn technique to lessen your symptoms. Like I said, if this is me Everything when this happens for me, it's regarding or a result of a trigger, a major latex reaction, a I overdid it on high histamine foods reactions. Drinking a green tea, a large green tea from a very popular coffee, um, chain, and then becoming completely disassociated on the way home while I'm driving, but thankfully, I was in the middle of nowhere at the time, and quite literally, it was after 10 o'clock. It was, like, after 11 o'clock at night. There were 0 cars on the freeway other than mine for 100 miles, which is because I was driving probably 30 miles under the speed limit because I knew I was disassociating, and it took me forever to get home. Uh, and then it took me 2 hours to find my house after I got off at the exit, and I only lived 15 minutes off of the exit. So, and I was completely aware that I was disassociated. I just was doing my best to try and stay calm because I needed to get home. Medications include, or for this condition, those that can treat pain, anxiety, depression, insomnia, or headaches that may occur. Any anti seizure medications prescribed to treat non epileptic seizures should be discontinued, as the attacks of PNES and those of epilepsy are not the same and are treated differently. Psychotherapy is also recommended to help modify your thought patterns and change emotions, mood, or behavior with possible cognitive behavior therapy, CBT, um, and relaxation, mindfulness exercises can help reduce stress. Let's see, physical, speech, and occupational therapy can help treat muscle weakness for those who have that as an issue. Redirecting attention. Uh, Redirection attention isn't gonna qualify for me because if I could stop an anaphylactic reaction by redirecting my attention, my ADHD would make me not have MCAS, because if a squirrel runs by wearing a sparkly skirt, suddenly I am on a completely different train track. So, that one doesn't necessarily quite or at all qualify for me. Other treatments, include things like transcranial magnetic stimulation using magnetic fields generated outside your skull to stimulate nerve cells in the brain and to treat depression and anxiety. Okay. Um, and you can find out more about FND at FND Hope International. Robin, let's see, you said to look up. You said to look up. If you're absent, how would you know? You don't know until you come back from it. Sometimes. Let's see. Um, FND seizure. We're looking at one more thing, and then we're going to end this video, and I will see you in the next one. I would like to ask for you to please follow, like, subscribe, comment, share, and everything else that is helpful for uh, getting my channel out there and helping me build community and create awareness. Functional neural, see, it took me back to FND. Functional, health, same thing. FND disorder, conversion disorder. I am, let's see, FND seizure. I need to find that. Checking to see partial onset seizure therapy, partial onset therapy, seizure therapy. Again, Not seeing. Let's see. FND seizures, functional seizures. FND open. Here we go. Here are symptoms. And let me share this one. All right, symptoms. This is from FND Hope. All right. Functional seizures. Functional seizures, commonly referred to as non-epileptic seizures, NES, is a descriptive term for a diverse group of disorders which refers to paroxysmal events that can be mistaken for epilepsy but are not due to epileptic disorder. There are two subcategories for NES, for functional seizures. Psychophysiological include a broad spectrum of disorders, e.g., syncope, paroxysms of acute neurological insults, paroxysmal toxic phenomena, non-toxic organic hallucinosis, non-epileptic myoclonus, sleep disorders, proximal movement disorders, I hope I'm pronouncing that right, endocrine disturbances, and transient ischemic attacks. Several factors can trigger a physiological seizure, such as abnormal sleeping patterns, excessive amounts of alcohol, fainting spells, hypoglycemia, low blood pressure, and other physiological conditions that affect the sugar and oxygen levels, as well as the flow of the blood flow of the brain. Interesting, because my best friend, who I have not seen in person since we moved, and who just happened to watch a few of my videos, actually asked me if I should go back. She suggested I go back to strict keto and intermittent fasting because none of the dissociative issues and involuntary movements were happening, and the slurring weren't happening when I'm strict keto and intermittent fasting. So that's very, very, very interesting. Dissociative disorders are involuntary and happen unconsciously. This is the most common type of NES, and the person has no control over the seizure. Associated with psychiatric conditions that can cause seizures, e.g., panic attacks. Hi, MCAS. Because my first domino for MCAS is if I become one of them, if I start becoming extremely aware of my heartbeat and like that I know things are, and then my tongue, like if that, I know this is the Benadryl right now because I will feel like $1,000,000 in a few minutes. When I'm past the dry mouth phase. However, yeah, the panic attacks are the scariest part of all of it because I don't know when I'm getting a panic attack, if it's just going to be a panic attack or if it's going to be a panic attack plus the rest of the dominoes that's going to turn into a major MCAS event like I had on Saturday night. I'm not going to lie, I was very close to epi. I'm not supposed to epi unless I can't or I'm having trouble breathing. I could breathe. I was doing my cromolyn sodium nebulizer. But I was so messed up. My resting heart rate didn't go below 95 for over an hour because I was in between. I hadn't been able to get my refill for my intramuscular Benadryl, and so I was out of it, and it was after I was completely out of it, and it was completely out of my system that it not good. Management, various treatments have been tried and successful. Treatment regimes for functional seizures include non-psychological anti-anxiety and antidepressant medication and psychological therapies. Okay, so here's the interesting part. For me, when I take my anti-anxiety med, it doesn't just stop the anxiety. It can also stop, for me, the progression of a reaction. It can act, which is the goal for MCAS, for things to not get worse. I'm not supposed to go to the hospital unless I can't breathe. I'm not supposed to epi unless I can't breathe. I'm not supposed to go to the hospital unless I have to use a second epi, because hospitals aren't set or set up for MCAS anaphylaxis, which is medically defined as anaphylaxis in and of itself is 2 or more body systems affected at once. And if I'm not going in with like the standard, my throat is closing anaphylaxis, the doctors are going to ask me why I'm there taking up space, because that's the last time I went. All right, so the fact that they mentioned anti-anxiety medication here is extremely interesting. And so there's, the difference between epileptic and non-epileptic seizures is, well, it can be difficult to tell the difference, but medical causes of transient neurological dysfunction with or without consciousness, syncope, vasovagal, or cardiogenic, or neurological, everyone's gonna, lovely, cerebrovascular, migraine, vertigo. I had a major vertigo issue last year after getting triggered with a latex allergy because they had just redone the blacktop on the sidewalk surrounding the townhome I lived in, and they had moved the cones, and I was an idiot and went for my mile walk with my dogs, even though I could still smell the rubber in the freshly poured, freshly hardened blacktop. Should not have done that because that night I had a major vertigo attack. I got up in the middle of the night to go to the bathroom, and it took me an hour to get back to bed because I had to like inchworm back to bed because I couldn't, my brain, gravity was stronger than my brain. I could not get up. Let's see. The parasomnias, movement disorders, startle-induced phenomena. I do have a very big, very easily set off startle response. Let's see. Endocrine metabolic hypoglycemia, hypocalcemia, hereditary fructose intolerance. Well, I don't do well with fruit, so I don't know. Drugs and alcohol, I mean, just the ones that are prescribed, but I don't do alcohol. Psychiatric disorders that may be mistaken for this include panic disorder, psychosis, attention deficit disorder, ADHD, depersonalization disorder, dissociative seizures. A significant number of patients, estimated up to 30%, having mixed epileptic and non-epileptic disorders. Features of functional seizures include biting the tip of the tongue. I haven't done that. Twitching in the arms and legs that last longer than 2 minutes. I've had my leg jerk that lasts all night, and that's always the night before my cycle. It's never random. I can tell you when it's going to happen, and I can tell you that the next day, either me or my daughter are going to start our cycles. Gradual onset, fluctuate in severity. Yes. Eyes are closed. I don't know. Side to side head movement. I think so, possibly. Crying or screaming. No, because I've always been aware enough that I needed to be calm for my daughter, especially when I was home with her by myself. Strong thrusting of hips, head and spine, and bent backwards. No. Functional seizures come with a lot of questions. What they are and what do they look like? And how do you feel about the diagnosis? Interesting. All right. So let's go to here. Stop sharing. And so there's more information on FND and the potential for that being an explanation. And something that I'm almost certain is going to be brought up by the specialists when I am being evaluated. I can't say one way or the other whether or not it's going to be just, what's going on, but the fact that FND itself, in the part where it said in the article that be distracting yourself with something else or being distracted can stop the physical symptom, that doesn't fit anything with me because I am 100%. They're always tied to histamine responses. Histamines spike and go high for allergic reactions. Histamines spike and go high during the cycle, because it's well known and well documented that your cycle can set off MCAS flares and etc. So, yeah. And I guess, right now, I know to put together a list of symptoms. I know to go through my videos and find ones that show episodes. And I know to expect this to be brought up by the doctors when I'm being evaluated. So, what do you think? Do you know anybody who has MCAS and or FND? Do you have one or the other? And if so, what's been your experience in the diagnostic and treatment process? I'd love to know in the comments. Please like, share, comment, subscribe, please, to the channel. I would love to have you join the community. And I will see you in the next video. All right. So that was the cutoff for that one. All right. Let's see. Hey, Sky. No, Robin, we can't have nothing. Tomas says it needs to be studied but there is more likely a relationship. MCAS made you react to Frosted Flakes. Robin, the Frosted Flakes probably have soy in them. And other things. I'm sorry. If you know about pain meds, if you know about pain meds safe for MCAS, let you know. I can find out. I can look and see like anti-inflammatory pain meds, or just like pain meds in general, because I can. I'm working on getting experts as guests, and I actually would like to start interviewing some other chronic illness warriors, influencers, regular people. But what kind of pain meds in particular? Like anti-inflammatory, because Eliana's on an anti-inflammatory because of how she's got chronic pain. All right, you're gonna tell the palliative care doc about this. Good. Your stress from reaction is fight or flight. Yeah, it 100% puts me in fight or flight. I can tell you with 100% absolute certainty, I know exactly what it feels like for, that whole deer caught in headlights scene. I know what a deer feels like when it sees the headlights that are coming in and it freezes it and it can't move. 100%. That's what I feel like. And that's the part that I'm terrified. That's why I want to stop when a reaction's starting. That's why I want to stop it as fast as possible, because I do not know if that panic attack is just a panic attack or if it's the beginning of the domino, and everything else is going to happen, and then it's going to get to that point, and I don't want that to happen. However, I can tell you that when I'm like, my friend's right, my best friend's right, when I am strict keto, it doesn't happen. So yeah, super interesting. And you have non-epileptic seizures, possibly. You're unlucky. I'll keep my fever highs. Nice, Robin. You don't know why your hives start either on your back or your stomach. The ones on your back, I think, are there just to peeve you off because you can't reach them to scratch. Robin, same with you. I feel like it's super random. Yeah, and yeah, it is. Hey, Ghost Town Gazette. Okay. Let's see. And when you start acting out of it, I'm like, Pauline is reacting. Okay, look, I want to tell you guys, if you see me acting weird, talking weird, like during that live that I did when I got my hair done, me and Eliana joke all the time. I did a TikTok live a while ago, and I was getting my hair done, and I totally zoned. I was losing consciousness, or like for like half a second, and like snapping back up. I was slurring. I sounded like a belligerent drunk that I would have kicked out of my own restaurant if I was serving them. I also was not being kind to my daughter, and that puts it lightly. I wasn't just joking with her when you go back and forth with our F-bomb drops. I was being downright mean. And she just let it go because, well, she doesn't care. Like, she knew, and I don't mean she didn't care about like me. I mean, like, tone is not an issue for her because of autism, for both of us. And she wasn't taking offense to what I was saying. She was hearing what I was saying and how I was saying it. You're itchy. If you take something, if you're itchy, you hate eating anymore because Sky says because it causes MCAS even to your safe foods. Sky, are you following an H? Are you on any H1s, H2s, MCAS stabilizing medications, mast cell stabilizing medications? Are you on cromolyn sodium? I'm not giving medical advice. I'm just asking, and if things to think about if you are not. No, I'm supposed to be on ibuprofen Tylenol with my GP. Did you know that aspirin is, again, not giving medical advice, just sharing personal experience and what I know. But aspirin is a mast cell stabilizer. You don't know you're reacting until you see a hive, because you're itching, and people can be confused because it'll be on your back stoma. All right, you already did your Benadryl. Okay. Yep. Yep, so did I. And I found out why today from my compounding pharmacist why I have a friend who's a pharmacist. I texted her in the middle of that massive reaction that I had, because it took so long to go away. I was considering epiing literally because I did not have I am Benadryl, but I had so much adrenaline going through me that I was afraid my heart would burst if I took it, and I figured it was more dangerous to take it than to wait it out. So, excuse me, I did not epi, and instead tried taking every other allowable over the counter or whatever, mast cell stabilizer, histamine stabilizer, all of that, because I could not take anything else. I'd already done I did one half of my mast cell bends at the beginning, waited 30 minutes, and took the other half. And because I was still sky high panicked. But yeah, my heart rate did not go down from 95 for over an hour. So that is crazy. Let's see. I hope your Benadryl kicks in. They tried more, but it gives you hives, so you don't know what the palliative care will do. I was told that if I do find that I need more to stay stable, to talk to my provider. At the point I'm at, 50 ml every 3 hours. I'm sorry, every 3 hours. 50 ml every 8 hours, 3 in a day. That's basically PICC line category. But again, I have mast cell activation syndrome. I have, but and more importantly, in this case, I also have latex adhesive ethylene hydrochloride and coconut allergy, which pretty much makes every single adhesive, topical, ointment, skin barrier, and treatment option, because I'm allergic to all corticosteroids and I'm allergic to anything that can be applied topically, except for like olive oil. Pick line would be a bad idea. So yeah, let's see. Yes. Sky's got a good question for you, Robin. You think a central line would be worth it if it was more than just IV Benadryl? Yes. If they have to add anything else, but I I don't know if I want to risk increasing my severity of my allergy already with everything else that, because I'm basically like on the road to the next reaction every single day anyway. But since I now know I have a steady prescription for my intramuscular Benadryl, I know that I should be generally okay, hopefully. I went all day on Friday with no reactions. Guess what? First time in my life, I'm able to actually save my anti-anxiety medication. I mean, I still take one, and I split it in half, and I take one. So one half of my prescribed dose. I take one half in the morning, one half at night, and I save the rest for emergencies with the IM Benadryl because I can. And on Friday, I actually got to go out to eat with my daughter and a friend on the way back from Jacksonville. That appointment and that trip to Florida will be a whole new video and a whole different story because I did record on the way, along through the process. But I made it till 9 o'clock at night before I actually reacted. That's crazy. Maybe the palliative care will try LDN or BENS. The LDN could be huge. You have to be careful of the PICC in ports, especially ports, because I know someone got an allergic reaction. I would react to my doctor cut herself off when she was like, wow, if you definitely know that you need to do this. And I was like, here's the link for Saturday's reaction. She was like, yeah, okay, I believe you. And she's like, we're at this point, we're at PICC line level, discussions, but we can't do that for you. And I'm like, I don't care. I can administer it myself. That's okay. So, but not the products. I don't react anymore. You have a regime that's safe for you. That's good. That's good. That same person has a PICC and is okay, but her port she was allergic to. Okay, that's interesting. I'll have to look into that. All right, let me see if there is anything else. Oh, I wanted to just share the last one that I wanted to do today, I think, is on, and I'm just leaving these videos open, these links open because I need to, oh, I forgot one. histamine and seizures, implications for the treatment of epilepsy. We have a separate video coming, people, and I'll have to add this one on, or I'll just connect it to the other one. All right, so we're gonna do a new video. It's made out of polyurethane. Have you and your daughter gone to Borough Clinic again? Sky, I'll talk about that in just 1 second, okay? All right, so this is not very long. This is actually super short. So we're going to make this. I will probably do a separate one on TikTok on this too, because I'm not paying for YouTube Premium, so I don't think I can download my stuff. But let's start a new video on Restream, intro and outro. And this one is going to be on histamine and epilepsy. All right, so let's see. Hi, everybody. Pauline from Chronically Spicy. I talk about mast cell activation syndrome, latex allergy, coconut allergy, a lot of other allergies, chronic illness, and medical gaslighting in general. And today I am talking about, we're going to do a quick read on a story about, not a story, a PubMed article. I need to find again. There we go. All right, this way I can share the proper story, the proper link, because this is why. Because I will be eventually evaluated for the potential seizure activity and potential mini stroke activity, because I've had instances with slurring and change in awareness and other symptoms that are on the list. And the one thing that I kept on telling my provider, the one that you mentioned, Sky, is that, yeah, but I can always tell you why it happened after it happened. It's never random. At the time, it seemed random, but it's never random because I can tell you that there is always a connection between a high histamine triggering event, either ingestion, like I ate or drank something that was super high in histamine. Like my daughter can drink green tea like it's water, like it's water. I used to be able to. Now it's automatic dry mouth, and if I take more than 3 sips, I'm in full panic, and I better take my medication, or I'm going to domino into potentially what this is. So we are looking at a story for a short study or abstract from PubMed, histamine and seizures, implications for the treatment of epilepsy. Abstract. Experimental studies have indicated that the central histamogenic neuron system plays an important role in the inhibition of seizures through stimulation of histamine H1 receptors, especially in the developmental period. This has theoretic implications for currently available drugs that act as histamine receptors. H1 receptor antagonists, including classical antihistamines and anti-allergy drugs, occasionally induce convulsions in healthy children and patients with epilepsy. In particular, promethazine, carboxamine, pyramine, and ketotifen should be used with caution in these patients. Not where I thought this was going. These drugs are widely used as components of over-the-counter medications. The use of the chlorphenamine activation study with EEG monitoring is useful for assessing the seizure susceptibility of patients who have had convulsions secondary to administration of H1 receptor antagonists. Okay, so that's not my category. My H1s and H2s actually stop stuff. Like treating my MCAS stops all of this stuff. But going on, H2 receptor antagonists have also occasionally been reported to reduce convulsions in critically ill and polymedicated patients and patients with chronic renal or hepatic failure. All right. Therefore, let's see. However, experimental findings have not been consistent with these clinical reports, such that the role of these receptors and their ligands in inducing seizures cannot be confirmed. Recently, H3 receptor antagonists, which enhance endogenous histamine release in the brain, have been demonstrated to have a potent anticonvulsant action. Therefore, these compounds may represent a new avenue for the development of an epileptic drugs. Interestingly enough, someone, I don't remember who, just mentioned to me that just suggested that I should look into H3s. And bring it up to it might have been my provider. I'm not sure. I have to check. But I need to look up H3s. The problem is, I don't know what H3s are made of, and what I'll have to look that will be its own post later. So yeah, there we go. Let me get back over here. Stop screen sharing. All right, so there you have it. The potential cause for some H1s and H2s potentially causing convulsions in epileptic-like seizures or symptoms in people who are on these medications, and that would basically be most of the MCAS and histamine and intolerance community. But apparently H3s have the possibility for being considered a treatment option. So that's something to look into. As always, if you have any questions, I'd love for you to leave a comment. Let me know what you think, what your thoughts are, if you experience the same thing, know anyone that does, or if you have a specific video or topic in mind for me to look into. Please like, share, subscribe, comment, and I will see you in the next video. All right, cool. So that was that one, and then I can do the one on my skincare. All right, let me see. I can do polyurethane, I think. And Sky, we haven't gone back in person. It's we only have to see her once. We only have to see in person once a year for telehealth, but we are patients. So yeah, there you go. All right, so let me find the pages for where do you live, Sky? Are you like are you in like driving distance at least? We were, I think it was a 13-hour drive from where we lived. But we just saved it for during the trip. Honestly, I think you'd be surprised. Then again, we planned ahead because once we got the date for when we were moving for my husband's job, I immediately called and was able to explain our situation and that we were stopping along the way while moving from Minnesota to Georgia. And we were able to get an appointment for my daughter and myself back to back on the same day. And it worked out just fine. I had 6 weeks to work with. So yeah, we we were able to get in. I would say that's relatively quickly. You want to go spring or summertime, I would most definitely get in touch with her office and see, let them know that you're interested. And see, maybe they can get you on the books now, so you know how to plan for for all of that. I am going to let's see here. One second here. I'm gonna duck off camera real quick, and I want to check one. I mean, this is over the counter Claritin, but I know it's still taking meds, so I'm not gonna do that on camera. All right, give me 1 second. I'm doing my H1s and my H2s for nighttime. Who wants a quick video on why I chewed for Benadryl? I called my pharmacist friend, and I asked, I'm like, I'm out of my intramuscular. I'm a mess. I'm freaking out. I need help right now because I'm actually considering pulling out my epi, but if I do that, I'm pretty sure my heart will explode, so I don't want to do that. And I was told what the max an adult can take in a day, and what that max can be within an hour, per dose. And I found out today why, but I chewed it. I chewed for Benadryl because my reaction was so bad. I was trying to get my system faster. I was so messed up, I couldn't even taste it. If you're 12 hours, that's not bad. And I can tell you that I was able to get in 6 weeks after I made my appointment. Like, I made my appointment for 6 weeks out because of like travel dates, like specific travel dates and such. So definitely call the office, and be prepared. The evaluation actually it's amazing because actually addresses neurodivergence and the connection between that and MCAS, EDS, and POTS. And my daughter and I both have appointments for Mayo Clinic for the EDS clinic March 26th, I think. But we have multiple appointments, and that whole week might end up being appointments. I have to check because I just got a call today, and I have to call her and be like, wait a minute, I don't know if I can handle all of this at once. What's the 300? The movie? I don't know what you're talking about, Robin. Okay. I finally got I to make an appointment now that my mom got new insurance and we can go out of state. That's awesome. Just so you know, on her she's telehealth the rest of the year, but as long as you can see her once a year, she can treat you. So that's what works. Oh, okay. Yeah, I think you'll be able to get in faster than you're expecting. So, all right, let me do one last one because I've had these products sitting, skincare products sitting on my table for way too long. Actually, no, there's 4 products. 3 skincare and 1 for laundry. This is specific for coconut allergy. Mayo, because my daughter and I both were, daughter was diagnosed, we were both diagnosed with hypermobile spectrum disorder, and she wants genetic testing to see if it's uh, if it's actually a different kind of a specific kind of EDS, as opposed to the general hypermobile spectrum disorder, and she figured genetic testing was a good way to go. So that's what we're scheduled for, and I think I might be going back for POTS evaluation too. Daughter has POTS. I'm pretty sure she wants to see if I have a different kind of POTS. So like eliminate possibilities. All right, let me see. I am just off camera here getting some meds ready for nighttime because daughter and I are both chronically ill and have a few to put together. Usually, I need you to repeat that, Robin, but in like English, but for like dummies, because I have no idea what you just said. Okay, I don't need. Do I have two of these? That could explain a lot. Oh, I do. All right, so let me put. All right, so this is going to be so this part's going to be so easy to cut out when I'm going through and breaking the videos up in CapCut. Like I was like, oh look, we don't need this entire section. And I don't even mind that there aren't a lot of people watching like live on YouTube, because this is one of the reasons I prefer to do lives on YouTube as opposed to TikTok, because they do not you can watch your favorite creators game, talk about whatever they're talking about, whatever their actual their platform is built on, and they can it can be 3 o'clock in the morning when they're posting, and you can watch it at 3 o'clock in the afternoon when they're sleeping, and if they're on the other side of the world, and it's fine because it doesn't go away. And guess what? I've got playlists. I have to add more, but I have playlists on YouTube. So like, if you're wondering, like, MCAS. Like I'm gonna do a video on MCAS. MCAS. Like what are the symptoms? What it looks like? What are basic treatments, etc. And histamine intolerant, same thing. Latex allergy, same thing. I'm gonna do like I've got a latex allergy playlist. I've got a coconut allergy playlist. Like I've got all of that over there. Let's see. Usually, CLADS isn't genetic testing, but it's autosomal recessive, and you have to meet the 3 major criteria plus skin testing. And you need 2 copies of the gene and skin biopsy to confirm. And the top 3 criteria to the diagnosis, I tell people because doctors won't test. My doctor noticing I don't scar is what changed my diagnosis from HEDS to CLEDS. What is CLEDS? Classically, okay. So 1 second. I need to find out when I can refill my famotidine because I am almost out. Okay, 1 minute. All right, there we go. All right, that's good. And then 1 minute. Almost there. Just getting the 2 piles together. Piles, yes. Good times. When you accidentally copy paste yourself and you send all the bad DNA along with it, it's like, yay. Good times. That's not. I didn't mean to do that, baby. I'm sorry. Okay. What am I missing? Oh, she needs one more of those. Okay. Okay. Oh, and Robin, by the way, you'll be proud. Little Miss is very, very, very good about making sure she keeps her salt with her, making sure she keeps her salt tablets with her that you did not recommend but told me existed on Amazon. And is very aware and pays attention to.
Order of a bag of salt and vinegar chips earlier, so I think I'm
Yeah.
probably good for the rest of the
Yeah,
day.
and knows when she needs to sit down. If I tell her to do the dishes while I'm walking the dogs, and I come back, and my 16-year-old is literally sitting on the floor in the kitchen, playing on her iPad or talking, chatting with one of her besties or her boyfriend on Discord. She just looks at me and says, yeah, standing wasn't a good idea anymore. So I sat down, and I'm like, okay, I understand.
To be fair, that last one has literally not been in new development for several years. So.
Yeah. All right. Let's see. Do I chew my medicine? It depends. Usually during an emergency situation, like when I'm having a major MCAS or allergic reaction, and like I chewed my Benadryl. Okay, so if I know I have anaphylaxis or MCAS reaction coming, going on, I will literally I'll chew the MCAS stabilizing anti-anxiety med that is absolutely the most nastiest thing I've ever tasted in my life. And to get it into my bloodstream quicker. But I also and make things, because that panic, that impending doom, that's a feeling I can't. It's crushing. It's fight or flight. Like I literally think like impending doom. It's bad. And the Benadryl, I tried doing the same thing on Saturday because I was out. I didn't have my intramuscular Benadryl. However, that was not. It didn't do anything. It did. It was still I timed it. It was still 47 minutes before my heart rate went below 95, and I was just sitting here. I will tell you, and I'm gonna have to do a video about this later if I remember. Somebody remind me, please. But I learned today. I'm not giving medical advice. I am just sharing what I know from personal experience. Research everything on your own. Talk to your doctor, and I am not a doctor on TikTok or pretending to be one, or on any other social media platform. So, not medical advice, personal experience. But I asked my pharmacist today why my body responds so well to intramuscular Benadryl. And you know what? We're going to do this as a short. Autonomic seizures. Huh. Yeah, we're gonna do this one as I'm doing it. I'm just gonna make. This is gonna be a video. All right. All right. So let me see. Hey everybody, it's Pauline from Chronically Spicy, and I have a short video share for you. Just a little heads up on something that I learned today. Not medical advice, just sharing personal experience. Do your research, talk to your doctors, and make sure you do what's safe for you, because I'm only sharing my personal experience. That's it. Okay. So that being said, I asked my doctor what I can do or why the Benadryl that I chewed during a severe MCAS reaction last week did nothing for me. And I had a heart rate over 95 for over an hour just sitting here. Pardon, it's almost time for some more meds. Anyway, short story. He said that I told him I'd already taken my H1s, all my H2s, etc., all of the mass stabilizing medications. And the short answer was that because I had neutralized the acid in my stomach, it could not break down the Benadryl for it to be effective. And I said, okay, well, then that's not just going to be when I'm having a reaction. That's going to be all the time, because I and most mast cell activation syndrome patients are taking H1s and H2s 2 to 3 times a day, sometimes 4 if they're breaking it, depending on their protocol with their doctors. And so the bottom line is I'm pretty sure that explains why so many MCAS patients end up on IV and IM, intramuscular, Benadryl, because our digestive system can't break it down for it to be effective to get into our bloodstreams, because we have to stay stable with the H1s and the H2s, and that neutralizes the Benadryl before it can even do anything for us. So yeah, I think that's something that you can look into. I plan on doing some research and doing an expanded video with reference links, etc. But I thought I would just share that little bit of info for you. And I hope you stay safe. I'll see you in the next video. Please like, share, and comment, and subscribe, and join our little family. I will see you in the next one. Okay. He was dehydrated, fell out of the chair, started seizing. I wonder if it was an electrolyte imbalance. Possibly. Do I have? Yeah. I'm pretty sure. You want to ask my oncology specialist about IV famotidine? So do I. Actually, but I'm wondering. I want to ask, but I don't, because, like you said, more than one medication in vial form that needs to be administered via syringe or IV. More than one medication might put me back on the PICC line possibility list, and we can't go there. I know I can go in it can go in your PBM form. Gotcha. Yeah. I seem to be okay right now. I seem to be okay with, let's put it this way. My hair came back, and was thick enough to, I mean, I remember you commenting on that one video I did, Robin, where my hair was like, my fro was like glorious. And it was me, right, supposed to straw. I was on my I was medicated. I was stable. Like, I can't tell you how much of a difference this actually has made for me. It's I wasn't expecting it to make any difference, because I could take Benadryl before. I was on 50 milligrams 4 times a day, compounded. I was paying $156 a bottle for apparently something that my body wasn't even digesting and breaking down. And I always wondered why it did nothing for me. Like, it literally did nothing for me. It did not stop reactions. It did not slow reactions down by itself. Like, I had to have my mast cell stabilizing bends for it to work with me. What if no PICC line? Can you do What is PIV? All right, we're gonna do my last video on the stuff that I use. Let me just make sure I have the 4 links up so I can share the ones that I'm using. Let's see. Okay, so first we have I don't do random with people. I don't do random invites with people who have not interacted with before, because the few times that I have, it's gotten weird. So if you want a spot on, I'm actually, and honestly, if you were paying attention, I'm recording videos right now and I'm chatting in between. So that would be a no. But if you're paying attention, yeah, I know they're annoying. Yes, I said it and you heard it. So anyway, autism filter, it's late and I didn't take any ADHD meds today. So executive functioning out the window. So anyway, as I was saying, if you do want to participate as a guest in a future live when I do one, and I have time to have guests, and if that's the focus, actually having guests on, comment and hang out in the chat. Don't just throw in a random invite because I'm not going to have you on. I don't welcome people into my house unless actually I've spoken to them outside of my house first. Okay.
The only time I think I've seen anybody welcome random people in is if it's meant to be a debate type of live, and still there's usually some kind of vetting, like a rule of only 18 and above that they'll put in like a black screen behind them. So that
Oh, Robin, glycerin, you reminded me. So my pharmacist told me that the easiest way, and I forgot who asked me about the chewing of medication, because I'm not recommending that people do that. I'm going to tell you if you do. I'm going to tell you that it's gross. However, if you find yourself in a situation where either you have, your windpipe feels swollen and your airway is not necessarily affected, but your windpipe feels swollen and it's hard to swallow pills, and you're trying to stop get an MCAS reaction or control, etc. My pharmacist told me that I could do these things. Again, not giving medical advice, just sharing what I know. Your job is to do your research, do due diligence, and talk to your doctor before you make any changes, etc. Okay, so now that I got that out of the way, I was told if this happens again and I'm in between refills, because where I live, everybody closes like at 6:30, 7:30, including the urgent care. So if if I needed IV Benadryl after 7:30 p.m. No, 5:30 p.m. when they close. I'm waiting until the next day to pick it up, or I'm going to the ER, and I don't want to pay ER prices for that kind of thing. So I will wait. So he said in those situations, the easiest way and the fastest way to help stabilize the MCAS reaction is to crush up the pills and put them in water and to drink it. He said hospice patients, they'll do that with Benadryl, and then the hospice worker, the caregiver, will dip their finger in the cup and run their fingers along the gum line of the patient, because there's more, the absorption in the gums is one way to get the medication into the system when you can't, or when the patient can't actually eat or drink. So that's one option. And Robin, the glycerin, that's why because he at first said, well, you should do the liquid version if it's an emergency. And I said, I can't because I'm allergic to, glycerin's an issue for me with coconut allergy because I don't know if, is it soy or is it coconut? And I frankly, no, I don't have time to call every manufacturer every single time for every single bottle. No. So I just avoid glycerin, which means I can't take anything for coughs, colds, sore throats, baby versions, all of it. They're out. I cannot do any of those. All right. Now let me, let's see. I'm gonna do my last video here. This is the one on the soaps that I use. And the skincare options that I use. Let's see. So I got one option. I just want to I'm getting the links up so that I can link share on YouTube. Robin, you need to be subbed to my YouTube. And honestly, I recommend anybody following, anybody in the chat, create a YouTube profile, even if you never intend to use it for other than commenting. Because I can, if you have a question and you want to discuss it on YouTube, I don't care if you have a cat avatar picture up or something or whatever, it doesn't matter. I can invite one guest on my on the live streaming platform that I'm currently using because I'm not paying for the one of the pro plans where I can have 4 guests or more until I actually hit 1,000 followers and can subscribers on YouTube and can monetize the channel. So hint, hint, get ye booties over there and click subscribe because and then I won't be repeating myself every 55 times a week answering the same questions. I want to answer them. I want you to have the information. I'm not saying I'm annoyed. I'm just saying it takes time out of answering other questions. And I'm trying to spend more time with my family and less time answering them questions over and over. So I'm trying to build kind of like a database of questions on YouTube. And that's where the PlayStations, that's where the playlists come in, which I don't have access to on TikTok yet because I'm below 10K. So, which is dumb, totally dumb. Okay, so I've got the second thing up. The last thing, or it's one, it's two. 1 second here. Make sure I've got 1 minute. Amazon. That's sea salt. Yeah, that one. Okay. That one. 6-pack. Dude, these guys have gone up. All right, 1 minute. All right, so there's one. That's two. That's one. All right. Over here, we will get this one because I have people. Amazingly, I'm only one of them. Like, I think I'm like the only person who's actively using the coconut allergy hashtag on YouTube. So like, wow. There might be others. I just haven't seen them. Let's just go Amazon.
If there is anyone else who's used it, I don't think it's been even close to recent.
Right. Okay, so let's see. But I've had multiple people ask me what I use for washing my hair, washing my body, washing my clothes. I'll tell you that when I go, when I went to Florida to get gaslit because that everybody likes to get screwed and pay for the hotel room after. I drove an hour and a half with my daughter for that appointment that I thought was going to be a lot different than it turned out to be, and I'll have a story. I'll post later. Yeah, we
Go to IKEA.
we had a silver lining, Elliot.
That is the only good part of that.
Yep, yeah, we had a silver lining. But I will have a story for you on that later because I'm not wasting the time that I put into the footage. However, let me finish the last video and then I can talk to you for a minute before I say good night, okay? All right, so give me a second here. All right, I got them all up. Let me get over to Restream. But anyway, as I was saying, Restream, if you want to just if you want to be a guest, if you want to talk to me, you have a rare illness or you have an experience you want to share, send me an email, chronicallyspicy@gmail.com. Send me a message on TikTok. See if you want to be a guest and we can talk about it. And you can do it without having to actually face. You can just voice it in with your avatar and we can talk. Hey Barb. All right, let me finish my last video that I'm recording for YouTube on this live, and then I will jump on over and just say hi to you guys over here for a little bit. But this is the last one I'm doing. All right, so let me get everything and start sharing the screen. Okay. Hey, it's Pauline from Chronically Spicy. I hope everybody's doing well. I talk about a lot of allergies, a lot of chronic illness, mast cell syndrome, and amongst the allergies I talk about include coconut allergy, latex allergy, and latex fruit syndrome, because there is a correlation. I will make sure I include links in the description below from the Asthma and Allergy Network regarding the connection between coconut allergy and latex allergy, but know that you can have one or the other or independently, and also know that one can lead to the other because they are progressive allergies, but it only happens in a certain percentage of people. So just be aware. That's where awareness of symptoms and progression is important, because if you notice new symptoms, you could potentially help to lessen things from getting worse in the future or slow the progression of allergy if you're aware. I was not, and I went from just rashes from Band-Aids 16 years ago to EpiPens and allergic to everything, including coconut. So here's the and coconut. Why is coconut a big deal? Because coconut derivatives are in everything from toothpaste, lotions, hair care, topical ointments. I am allergic to the entire. I can't wash my hair with shampoo. I can't use conditioner. I can't use mouthwash. I can't do cough medicine. I cannot do any liquid medications. Because glycerin, because I have to watch the kind of coffee creamer that I drink, because I use coffee creamer, the Chobani coffee creamer that my husband found that is safe for me, that I will pour onto frozen berries as frozen blueberries as a dessert. And guess why we can use that one? Because it doesn't contain polysorbate 80. Guess what polysorbate 80 is? It's a coconut-derived product. And guess what else that's in? That is in Xolair. And it's in both the kind that is pre-filled and has latex in the tip, and also in the kind that is not pre-filled and has to be administered at the doctor's office. So I can't do Xolair, which sucks. However, that's just one or two of many ingredients that are derived from coconut. Sodium lauryl sulfate, sodium laureth sulfate, anything that says palmitate, any tocopherols, vitamin E, That's why essential oils are pretty much out for me, because I can have, and I had this happen last summer. Um, uh, Local crafter made I bought some essential oil roll-ons, and I had asked if they were coconut safe, and she was like, they're the only coconut safe things I have. And she's like, she read me the ingredients, and it was my fault for missing this, because I know for a fact that jojoba oil is usually not just jojoba oil. If you're getting the $4 little bottle from Target, and you're making, like, because I used to make essential oil, like, mixes too. It's usually the carrier is usually a coconut derivative. So there's a lot that goes into what I can't have with that. So what I'm going to show you are the four main products that I can't live without. This isn't sponsored. I bought these with my own money. These companies don't even know I exist. Let me share screen so I can show you what I got. 1 second here. Nope, over here. All right. So the first thing that I use. Now, this is the Kiss My Face. This is the one that most people are talking about. And there's multiple options if you look on Amazon for soaps. But you have to be very, very, very careful with soap, because everyone is going to tell you Dr. Bronner's is safe. No, it's not. It's got coconut derivatives. It's almost all coconut. There's a ton of coconut derivatives. So you have to read every ingredient. I will not do the scented version of this, because I don't know what the essential oil from the lavender. I don't know what the carrier was, and I'm not going to find out, so can't do that. I will tell you right now, I have, this is old Kiss My Face. And by old, I mean I've had this for a couple of months. It moved with us. It's currently unavailable on Amazon, and we don't know when or if this item will be back in stock, which is why people keep on asking me what they can use instead. And by the way, even if it's out of stock, it's look at what it's listed at for the price. The price right now for this stuff is listed at for one of them was listed at for like $42. But it doesn't even matter. But yeah, no features offered available right now. So Kiss My Face is out right now, unless you want for the plain one that is completely safe. Let me show you why it's safe. Even though it's not available, I'm going to show you the ingredients. First of all, you look and you see no parabens, no platelets, no sodium lauryl or laureth sulfates, which is what makes me allergic to toothpaste. All toothpaste, there is not a single toothpaste I have found that doesn't contain one or the other, or glycerin, or all three. Artificial colors, doesn't contain mineral oils or formaldehyde donors. What it does contain is this. 1 second. All right, here we go. Inactive ingredients: sodium olivate, saponified olive oil, aqua, water, and sodium chloride, sea salt. That's it. That is all it contains. And that is all I'm going to use. I do not use anything else for, like, I do not use any soaps that contain any kind of allergen for coconut, because that's just asking for trouble. So instead of Kiss My Face, I did some research and found this brand. It's the Papoutsanis Pure Greek Olive Oil of bars, 8.8 ounce pack of 4. These things are huge. My husband was super impressed because he uses the same soap that I do, so that I don't have reactions to him. Look how thick that is. And it smells just pure and clean and lovely, and I've never reacted to it because it's safe and it's only $16.75 for 4, and they last forever. Now, this is literally like a Greek product. Most of this package is in Greek. Is actually in Greek. But I kept on looking and finally found the section in English for the ingredients, and they are sodium olivate, saponified olive oil, okay, aqua sodium chloride, right, and citric acid in natural a natural pH for natural pH balance. There's no preservatives, no colorants, and no animal ingredients. And this bar lasts forever. And I love it. And so I highly recommend this. I'm supposed to have an Amazon storefront. I don't know how to set it up properly right now. Apparently, I just have wish lists set up that were supposed to actually be like an actual storefront. I don't know how to do that. I have looked at every tutorial. I'm giving up on actually trying. Forget it. I'm not meant to be an influencer because I don't know how to handle that. So I'm just telling you this exists on Amazon in general, and you do with that what you will. Let me show you the last thing that I use, and this is the spendy one. Because Dr. Bronner's, see, I'm gonna have to do this. I don't want to do this, but I have to do this. Because when people say Castile soap, everybody automatically thinks Dr. Bronner's, okay? And they're like, but Dr. Bronner's is safe for babies. Yeah, that's right. If they're not allergic. Yeah, and I tried Dr. Bronner's too. It was actually one of the first things I went to. And then I learned that, there's a whole lot more going on than what we think is allergens, or not allergens. All right, so Dr. Bronner's, we're going to share this tab. I'm going to show you, let's look at Dr. Bronner's baby, because everybody's like, use the baby version. You know, that's unscented. It's awesome. It's safe for you. Probably not, but let's look anyway. Let's see. All right. Is it actually going to show me ingredients? Number one, it says vegan. So like, I'm like automatically like, okay, so that means coconut. No offense to vegans. I'm just saying, it doesn't have any foaming agents. That's good though. And I like that it's packaged in a recycled bottle. All right, now let's look down because we need to look at ingredients. And if you can't find actual ingredients, you don't want to be, I wouldn't buy something that I couldn't see the full ingredients list on for coconut allergy, because there's not very much you can actually put on to make things feel better if you're actually allergic to it and then you have a reaction. Okay. Let's look. I need the ingredients list, people. Let's get to it. Okay. And there we go. Okay, done. We're done. All right. Water, saponified organic coconut, and organic olive oils. Want to know why they add the olive oil? Because Castile soap was traditionally made with just olive oil. Okay, that was like the original when you used to say Castile, like back in the day, back in olden times, like back in when Castile soap was first invented and all of that, when it first originated, Castile meant olive oil, except corporate America learned that it's cheaper to throw in extras and skimp on the olive oil and add other things like coconut because it's a cheaper product and easy to source. So yeah, right there, the very first ingredient is coconut, a mix of coconut and organic olive oils. And then it has retained glycerin, which means it could be it's either soy or coconut. Organic hemp oil, if that's anything related to the plant, is a potential latex cross. Jojoba oil, I want to know what the carrier is. Citric acid and vitamin E. Vitamin E probably means mixed cocoa barrels, so that is a no. Hey, Elise. And so yeah, so this is, I showed you this because when someone says it's hypoallergenic, or someone says it's safe for babies, or someone says I didn't have any reactions to it. That's great. Look at the ingredients list anyway. So I use this instead. I have my bottle right here. It's Penn's Hill organic unscented head to toe body wash, organic extra virgin olive oil, artisan liquid Castile soap, half gallon, 1.89 liters. Okay. And you have an option of either buying the half gallon for $64.99. Yes, I know that's spendy. Or you can buy the I believe it's a 16-ounce bottle of the same brand. It's a small family business that runs this, so I like supporting them. Thing is, shipping's gonna be like $15 either way, so I would rather just pay the extra shipping, the shipping price. Oops, here we go. Forgot to share the screen. So yeah, Penn's Hill right here. This is what it is. And we're going to go close on this so you can see. And the about section, organic olive oil soap unscented, half gallon, detergent free, paraben free, vegan. In this case, that's okay. Coconut oil free, palm and nut oil free, unscented. Thank you. Thank you. Thank you. And I use this to wash my hair. I use it as my hand soap, and I will also use it to hand wash clothes because I wear a lot of merino wool, and I usually just spot wash my stuff. I've had this doing a 30-day challenge right now with a company called Wool, and again, not sponsored. I actually earn a $30 gift card for wearing the same dress for 30 days in a row. And I've been in love with this company for years. It's like slow fashion, like hobby, fascination, and plus it's soft and I love it. Anyway, I will use it to hand wash my clothes because I can't use like Woolite or anything. Product description: organic olive oil, liquid unscented soap, best-selling. It's a best-selling product. The demand for unscented liquid soap is so strong that we're offering it in volume. Do you need a gentle organic soap that is only made with olive oil? If you need soap that is free of coconut, palm, and or nut oil, thank you. You just found it. It took us over a year of research and developing to have a product worthy of the Penn's Hill Soap Company label. We never expected our liquid soap to be our most popular, and what was even greater surprise is that our unscented soaps are by far the most popular items we make. Guess why? Because people need it because we can't find it anywhere else. And I am willing to pay $15 to have this thing shipped to my house. I am not gonna pay $15 to have a 16-ounce bottle shipped to my house. So yeah, no. But anyway, they say customers ask why Pencil Organic liquid olive oil soap makes their skin feel so soft. Well, according to the International Olive Oil Council, I didn't know that existed, and now I found a new rabbit hole I want to go down later, like not right now. Unfiltered extra virgin olive oil, which is technically juice, contains super nutrients including vitamin E, essential fatty acids, and it contains the nutrients. So there's no mixed tocopherols in there, right? Essential fatty acids, antioxidants such as polyphenols, which help prevent damage to cells caused by free radical oxidation. And by using only olive oil instead of a blend, not mentioning anybody else. The result is a gentle liquid soap that moisturizes and pampers the skin. You will not find any artificial coloring, synthetic perfume, or chemicals you can't pronounce in our soaps. Thank you. Your skin is wrapped in rich natural emollients that cleanse and pamper from head to toe. Organic olive oil soap can be used as a shampoo, hand soap, body wash, and even a shaving soap. Yes, and I have used it to hand wash clothes. So, True Castile soap is made from olive oil, not a blend of less expensive oils like coconut and palm. And that's exactly why they do it, because it cuts cost. All natural gentle soap that retains its natural glycerin, and because it's natural glycerin from the olive oils that's saponified, not allergic to it. It's the only glycerin I'm not allergic to. This soap makes a wonderful shaving soap and body wash. Customers tell us they use it to wash delicate clothes and wooden kitchenware like utensils and cutting boards. And I use it as a shampoo too. So let's go over here. So that is what I use right there. Oh, I forgot the last thing before I go. What I use to wash my clothes. Let me open that up real quick. I know I have it. 1 second. Because I went through, I can tell you right now that every single item in the laundry detergent aisle, I'm allergic to. I don't care if you tell me if it's Draft Baby. I don't care if you tell me if it's Tide Free and Clear. It's going to contain a coconut allergen. And it's going to most likely contain glycerin. And unless you literally can get 100% verification from the manufacturer that glycerin is not derived from the source that you're allergic to, I'd be careful using anything else. I will say that I do not use any of them. I use Molly Suds. Okay, this is what I use: Molly Suds detergent, and it only contains sodium carbonate sourced from Green River Basin in Wyoming, sodium bicarbonate, magnesium sulfate, and unrefined sea salt. That is it. This is the one that I buy right here. Let me see if I'm sharing the correct screen. No, I am not. 1 second. Go back over here. I'm still learning. All right. Share screen. Here we go. All right. That is what I'm using. I am currently using Molly Suds laundry product. Never mind, not currently. I will for the rest of my life be using Molly Suds laundry powder, ultra unscented, and it's a powder form. I can do 120 loads. It is the only one I use. I've checked. The liquid version of Molly Suds does contain coconut derivatives, so don't go there. Or I would recommend not going there. I wouldn't go there. And I also would not myself use any of the scented versions because again, you don't know, and I don't know what the carrier is in the essential oil that was that soap that essential oil was mixed with. So and it doesn't really have to be listed like that specifically. I did check this right here, the Molly Suds natural detergent soap, and we'll take a quick look real quick so you can see. Ingredients contain, let's see, material type. No, I don't care what it's free of. I want to look and see what it has. That's what matters. Okay, let's see. Yep. Yes. Okay. Ingredients. That's what I want to know. Taking a long time to get there, Molly. I love you and I love your products. And I bought them for myself, but this isn't sponsored, but I need to know what is in this in the stuff. Let's tell me what is in the stuff, Molly. Just give me the ingredients list. Oh my god. Okay, 1 second. Let's go all the way back up here. See, I don't like it when you make me work either. Okay, here we go. All right, so here we go. Scented with citrus essential oils. That's automatic. Nope, because I don't know I don't know what the essential oils are mixed with. Hypoallergenic and 100% free from artificial dyes, fragrances, and other harmful chemicals. Gentle clean rinsing detergent, ideal for those with eczema or other skin sensitivities. Ultra concentrated, stain fighting, etc., etc. That's nice. What are the ingredients? Don't tell me what to fill. I don't need to know how to use it yet. I need to know what's in it. Okay. And that's a no. Okay. So, earth-derived ingredients. See, earth-derived ingredients is usually an automatic. That's not going to work for me. But this is the only exception. Okay. Right here. Palm oil is what is derived from palm trees, and coconuts come from palm trees. And because companies don't legally have to, and this is convenient, but because companies don't legally, according to FDA, define whether or not or what kind of palm tree the palm oil is derived from. We don't know if it's a coconut palm or not, so it's just safer to assume that it's not. But the ingredients in the liquid formation of Molly Suds is water, decyl glucoside, that's the coconut derivative, glycerin, that's either soy or coconut, sodium carbonate, lauryl glucoside, laurel means coconut, natural fragrance, not touching that right there at all, sodium gluconate, I have to look that one up. And sodium oleate, I have no idea. Naturally occurring enzymes. Okay, but that's like 3 coconut things that I know of. So that means that my only option is the natural right here. And the only ingredients in this stuff is it's good for 100 loads. And the only ingredients in this stuff is literally what I mentioned. But make sure you put the detergent powder in where you're supposed to in your laundry machine and not directly in with the clothes, because otherwise you're gonna have well, let's just say I've had to wash my clothes a couple times because I oopsed and just put the stuff in with. But here's the ingredients right here. Comprised of only 4 earth-derived ingredients: sodium bicarbonate, sourced from the Green River, sodium carbonate, and magnesium sulfate, unrefined sea salt. That's it. That's what I use. If you have any questions or are looking for other products for coconut allergy or any other condition or sensitivity that you may have, feel free to shoot me an email at chronicallyspicy, send me a message on TikTok, leave a comment on this video. Please like, subscribe, and definitely subscribe. And I will add this I have to create a coconut allergy playlist if I don't already have one, but I will. And I'll see you in the next video. Thanks for stopping by, and have a great night and stay safe. This time I'm actually on for real. All right, so here we go. And